It is indeed a privilege and an honor to welcome and address you as we gather today for the Regional SADC Malaria Day 2024 commemoration and launch of the Zimbabwe Zero Malaria Starts With Me campaign. The SADC Malaria Day is an important milestone which brings together the region's ministries of health, leaders, policymakers, healthcare professionals, and community representatives inspired by passion, unity, and determination to eliminate malaria in Southern Africa. It is heartwarming to see our collective efforts, dedication, and unwavering commitment to fighting malaria, a disease that has for too long been a scourge on our people and a barrier to our socio-economic development. Therefore, eliminating malaria will make the region a safer and better place for economic development and prosperity. The theme of this year's commemoration, resilient health systems and communities key to malaria elimination, underscores the fundamental truth that malaria elimination cannot be achieved without robust health systems that can be accessed by all citizens, including the most vulnerable. Furthermore, the slogan, timely access to malaria services, everyone's right, reflects our moral and ethical responsibility as leaders to prioritize the health of our populations, ensure equitable access to essential services, and actively work towards the elimination of malaria as a public health threat. In this endeavor, no one and no place is left behind in our fight against this preventable disease. Everyone in SADC has the right to access malaria prevention, diagnostic and treatment services promptly, without discrimination. As a collective, we maintain that no individual should die from malaria simply because they could not receive care on time. Distinguished guests, ladies and gentlemen, malaria remains a distressing disease in our region. Approximately 83% of the estimated 407 million people in our region live in malaria risk areas. In 2023, malaria cases increased by 13% from 66.8 million in 2022 to 76 million cases. Malaria deaths decreased by 9.7% from 42,867 in 2022 to 38,740 in 2023. Children under the age of 5 years accounted for 57% of the 2023 deaths. These statistics indicate that the region is lagging behind in terms of eliminating malaria by 2030. Some of the strategies to put us back on track include strengthening health systems by investing in health infrastructure and workforce capacity, improved surveillance, cross-border collaboration, enhancing domestic financing and community participation. You will all agree that with increased travel, trade and population mobility, diseases that once seemed confined to specific regions now have the potential to spread rapidly across borders, affecting millions of our populations in the region. We have seen this repeatedly from Ebola outbreaks and the spread of COVID-19 across continents, and now the Mpox. But these challenges also present an opportunity for us to unite and collaborate to safeguard the health of our region. Regional collaboration has been one of the hallmarks of SADC's malaria elimination strategy, and I am proud of the strides we have made together. Through cross-border malaria initiatives, we have continued to demonstrate that regional solidarity is pivotal to overcoming this challenge. Ladies and gentlemen, our efforts in building resilient health systems must be holistic and grounded in the principles of universal health coverage. This involves improving the accessibility of malaria testing and treatment services, expanding coverage of vector control measures such as indoor residual spraying and insecticide-treated mosquito nets, and ensuring that every citizen has the correct information on malaria prevention, control, and elimination, regardless of their geographical location. It is pertinent that we engage our communities, as they are key in ensuring that our efforts are sustainable and resilient. Communities living along borders often face unique challenges, including frequent movement between countries and inconsistent health care services, making them more vulnerable to malaria. In that regard, community participation and ownership of malaria prevention, control, and elimination initiatives must be at the core of our strategy. This must be reinforced by joint malaria prevention and education initiatives, drawing lessons of interventions that worked so that prevention strategies are synchronized in country and on both sides of the borders to ensure coverage across the entire region. I wish to acknowledge the critical role played by our community health workers and volunteers. These men and women are the unsung heroes of malaria elimination efforts across our region. They work tirelessly, often under challenging conditions, to bring life-saving information, diagnostics, and treatment to the doorsteps of the most in need. As the chair of SADC, Zimbabwe calls on all member states to renew our promise in the Windhoek Declaration to eliminate malaria in SADC region, in SADC by 2030. You recall that in that declaration, we made the commitment to increase domestic financing towards malaria and urged partners and stakeholders to continue prioritizing the equitable distribution of resources as well as the strengthening health services in those areas that remain underserved. This includes ensuring that essential medicines, rapid diagnostic tools, and prevention measures are available and accessible to all. I wish to acknowledge the continued support from our development partners, including the World Health Organization, the Global Fund, the Rollback Malaria Partnership to End Malaria, African Leaders Malaria Alliance, President Malaria Initiative, and other international and regional organizations whose financial and technical contributions remain critical in the fight against malaria. Let us remember that timely access to malaria services is everyone's right. Distinguished guests, ladies and gentlemen, today Zimbabwe joined 24 African countries that have launched the Zero Malaria Starts With Me, a continent-wide campaign which was endorsed by African leaders on 2nd July 2018. The campaign calls for everyone to play their part in ensuring that our countries realize zero local malaria cases by 2030. As we launch this campaign, Zimbabwe is committing to step up the fight to end this deadly disease by maintaining malaria high on the national agenda, mobilizing domestic resources, and continuing to prioritize the engagement of communities to take ownership of the fight against malaria. Government will redouble efforts to ensure that everyone at risk of malaria can access the services they need to prevent, diagnose, and treat malaria. Let me take this opportunity to once again commend our community health workers who have continued to ensure timely access to malaria testing and treatment services within the communities even during the COVID-19 pandemic. Well done. In 2023, 54% of all the malaria cases were treated by community health workers. Ladies and gentlemen, I would like to reiterate that no one can fight this battle alone. We are all in it together. Attaining zero malaria in Zimbabwe will promote not only the health of the population, but also free up resources to address other health and development priorities, and accelerate the attainment of our President, His Excellency Comrade Dr. Emmerson Dambudzo Mnangagwa's vision of a prosperous and empowered middle-income society by 2030. The attainment of zero malaria attests to a broad-based and inclusive social development of our communities. I implore all private and public stakeholders, as well as the communities, to join government in taking up responsibility of ensuring that all play a part in preventing, controlling, and eliminating malaria in our homes, work areas, and environments. I urge our partners, stakeholders, and communities to join the campaign and embrace the vision of Zero Malaria Starts With Me campaign. As government, we remain determined to reach the vulnerable groups and special populations with malaria interventions. In due course, the Ministry of Health and Child Care, in consultation with other ministries, government departments, private sector, civil society, and partners, will spearhead the formation and launching of the End Malaria Council, comprising members of both private and public sectors. The Council's mandate will be to raise additional domestic financing for malaria elimination through the establishment of an End Malaria Council to complement annual allocation from Treasury, as well as donor contribution. This will enhance domestic financing, country ownership, and sustainability. The End Malaria Council will also provide oversight on the use of the raised End Malaria funds. Distinguished guests, ladies and gentlemen, as I conclude my remarks, let me repeat the slogan which I have taught you already. Zero malaria. Starts with me. I didn't hear you. Zero malaria. Starts with me. Kupedza malaria. Ukweda malaria. A malaria-free Zimbabwe, a malaria-free SADC is possible. We all have the responsibility to make it happen. At this juncture, it is now my singular honor to declare the Zimbabwe Zero Malaria Starts With Me campaign and the SADC Zero Malaria Starts With Me officially launched. I thank you.